So, how do we do an NMT? We massage the area, as always, we make sure it's warm and soft, so under no point should we be kind of using this technique before 10 minutes minimum to ensure that that tissue is nice and relaxed. Locate that tender trigger point. Apply a slow, increased pressure guided by your client. And we need to ask them on a scale of 1 to 10, 1 being not painful, 10 being the most they've ever experienced. And we need to get them to a 7. So we need to get them to a 7 on their pain scale. We then need to hold it for 7 seconds. We count 7. We then ask our client, is the pain going up? Then we come off. If the pain isn't going up, or the pain is staying the same, or the pain is referring, we still keep the pressure on. Once we've okayed with the 7-second test and we're still maintaining that pressure, we're still holding the pressure there, we keep holding it, we then ask our client to say, right, let me know when you get to a 3 on your pain scale. They may have to breathe nice and deeply, but keep that pressure applied. When you get to a 3, ask your client to take a deep breath in. They're going to breathe out slowly and you're going to apply more pressure. You're going to take them back up to a 7 again. And then when you get to a 7, you're going to hold it there until the pressure decreases. And we're going to do that 2 more times. We do it 3 times in total. Once we're on our 3rd cycle and we get down to 3, we remove whichever bony landmark, whether it's a knuckle, whether it's an elbow. We're going to come out slowly and then we're going to lightly effleurage the area and then at the end stretch that tissue out so that the client is getting the full benefit of that technique. We need to let them know that there may be bruising, it may feel very sore, it may feel like they have been punched, is probably a dramatic word, but we need to let them know that that's going to be very tender and very sore. We must make sure as therapists that we maintain our posture and that their position and pressure, it's direct pressure. We must remember that when we use thumbs, thenar eminences, ulnar borders, olecranon processes and knuckles, that we lose that sensation, that palpation. We might need to brace ourselves when we're doing this, but please don't keep using thumbs. Get happy with using those knuckles and bony landmarks to make sure we're happy with that. Application. So once we follow the release with postural assessment and advice, we then give some stretching. We then need to address any training issues. We need to address the posture if it's there. Think about what else they might be doing at work, if there's anything we can help with there, swapping handbags. We then need to assess and reassess. So the benefits of doing this, we will get a reduction in hypertonic muscles. We get restoration of muscle-skeletal imbalances. We get a reduction of ischemia. We get removal of tender and trigger points. We get restoration of flexibility. We get improved range of motion, improved posture, and increased nutrition to the muscles. Short term helps restore homeostasis to that balance, and we can then hopefully get it to retrain those neurological impulses. Chronic conditions, we need to tackle what's going on chronically and why that's happening. It's a good diagnostic tool, very good therapeutic techniques. It's a safe technique, again, as long as we make sure that we inform our client what's going to happen. Incorporates well within massage and can replace more aggressive techniques that are out there. So just to recap, just so everyone's happy, we warm the area, we locate that tender trigger point, we then take our client up to a pain scale of 7 on their pain scale. We then hold it for 7 seconds, and once we've held it for 7 seconds, we don't change the pressure. We ask our client, so Bob, how's the pain doing? Is it going up? Is it going down? Is it staying the same? Is it staying local, or is it referring? So is it going up? Is it going down? Is it staying the same? Is it referring? Or is it staying local? That's giving us a guide. So if the pain is going up, we must stop what we're doing immediately. If the pain is going down, we can continue. We don't change the pressure. If the pain is referring somewhere else, we stay where we are. If the pain is staying local, we are also safe. Once our client has then got down to a 3 on their pain scale, we then ask them to take a deep breath in. They then breathe out slowly, and we take them back up to a 7 again. And as I said before, we keep doing this process. We do it 3 times, we take them up to a 7, wait till it drops to a 3, we take them back to a 7, wait till it drops to a 3, back to a 7, and wait till it drops to a 3. And on that last cycle, we ensure that we come up nice and slowly to allow that fluid to flow back into that area nice and slowly. And then light massage over the top. We then make sure that we give that tissue a stretch. We may want to do it at the end, or we may want to give it for our clients to do. We must make sure that we address what else is going on, otherwise it could come back.